This is the Lone Crater YouTube. We hope this video helps.
You begin by confirming precautions and patient identity, put on appropriate PPE, and explain your actions. You remove the soiled linens systematically, top sheet, blankets, pillowcase, rolling inward to contain contamination, and place them in the laundry bag. Once done, check the mattress and rails for tears, stains, or foreign objects so you can report or replace before continuing. Make sure the bed is in a flat, safe position and breaks, engaged to work efficiently. You slide the fitted sheet onto the mattress, anchoring each corner securely and smoothing to remove wrinkles that cause pressure points. Next, position the draw sheet at mid-torso length to assist with transfers and minimize friction. Tuck it under the mattress on both sides. Once that is set, lay the top sheet and blanket with hospital-identified edges outward, aligning at the foot and folding a hospital corner to keep linens tidy and readable for staff. You finish by fluffing and positioning the pillow, adjusting bed height and side rails to the patient's comfort and safety, and placing the call bell within reach. Make sure bedside items are organized and the bed looks tidy. Explain the setup to the patient as you go. If you notice wrinkles, dampness, or misaligned sheets that could cause skin injury, replace that linen right away. Stop and redo the layer rather than risking pressure injury or contamination.
Thanks for watching. Consider subscribing if we helped you.